I'm going to give you a little bit of my background because I don't want you thinking I'm picking on people of a certain political persuasion. When I was in high school, I grew up in the Goldwater campaign. When I went to college, I was a member of the Young Americans for Freedom, a very conservative group that talked Reagan into running for governor and later for president. I published one of the few conservative underground newspapers in the Southwest. I was active in all kinds of Republican politics. I was involved in Paul Eggers' campaign, who was the first legitimate Republican contender for governor in Texas. Through the years, I've been a delegate to multiple Republican state conventions, county conventions, you name it. In college, I debated multiple people. Back then, it was dangerous to be a conservative. There were, I think, 1,200 bombings on college campuses when I was there. I can debate Ayn Rand objectivism, the libertarian philosophy, traditional conservatism with the best of them. And in the past, some of our adversaries for organized medicine have been mainly from the far left, plaintiffs' attorneys and that type of thing. But there has arisen a new group, and some people call them the far right. Some people call them members of the Tea Party. I call them faux conservatives because what they do has really nothing with conservative philosophy. It deals with power and control. We first ran into these folks the last legislative session with our end-of-life bill because they wanted to have power and control over even end-of-life issues. How many people here have read 1984? Wow, there's a lot of old people here. Actually, I read it when I was in high school when 1984 was still the future. I think you remember in that book that the world is divided up into 3 totalitarian countries or societies. And the government in those countries is not only interested in controlling the actions of their citizens, but their thoughts and their minds. And one of the ways they do that is called doublespeak. You know, you say the opposite of the meaning of a word enough, with enough conviction and enough frequency, or the meaning of an event, which is totally different, with enough frequency and conviction, that eventually people believe it and it becomes true. As we say in politics, perception is reality. Well, just remember doublespeak. And I'm going to run some clips here of a last election. This is a special Senate race 28 up in kind of my neck of the woods by an individual that won that race who has been a legislator and is an extreme advocate of this group. And also a clip of a lady that's now running for the Senate over in Tarrant County, also an extreme advocate for these groups. And then follow that up with a segment from the chiropractors also, whose memberships sometimes fall in line with these groups. And let me tell you, these groups are really, I say groups, because they're comprised mainly of about 4 or 5 individuals that control them. About 2 or 3 individuals that are wealthy contributors that contribute millions to these groups, but they're certainly not, in any stretch of the imagination, grassroots. So, Steve, let's run it.
Last number I heard, only about 30% of the physicians out there support TMA. I don't know exactly what the number is, but it's fairly low. It's not a majority for sure. So, and they just have a track record of being fairly anti-life or adverse to that. They were very much strong advocates for Medicaid expansion and Obamacare.
Also, I'm a little concerned, the Texas Medical Association is not necessarily on the side of Obamacare, and I don't know if everybody knows that. They were one of the organizations that went down to Austin this last session and really lobbied to push the expansion of Medicaid, which is the way we get Obamacare in Texas. So that's something that you need to be aware of, and the endorsements in this race, that's important.
Okay, you only got a little bit of Charles Perry. Actually, he went on for about 5 minutes in a diatribe against the TMA. And these were not random reflections, because in the Empower Texas website and on their emails the next day, these same things came up. And it's joining the TMA name with an adjective. The pro-abortion TMA. You didn't see his clip on where he charged the TMA with being pro-euthanasia, carrying what he called the euthanasia bill. The liberal TMA, the pro-Obama TMA. And it really gets to the point where it almost really it just pisses you off to listen to it. And even now, I still even now, even to y'all, I want to defend what's being said, because we're not a political organization. We're not liberal or conservative, because we have one criteria: what's best for patient care in Texas, and that's our standard. It has nothing to do with political philosophy. We're not pro-life, or we're not pro-choice, because our members are divided. We have people on both sides. We're not for euthanasia. We're for giving compassionate care to control suffering at the end of life. And let me show you some other things. When we had that end-of-life bill, which is a bill that was written basically by the Catholic Church, by the Council of Catholic Bishops, and we carried that, and we talked about suffering. And you know the old adage, cure sometimes, relieve suffering always. Who could attack that? Well, let's look at Doublespeak. This is a letter that Charles Perry and a handful of other representatives signed, and this addresses our comments on suffering. On the question of suffering, we all suffer in our own way, and sometimes, but usually not, on our own terms. The manner and degree to which we suffer should be our own choice, not one imposed by another's concept of suffering, and certainly not by people who have a financial conflict of interest in prematurely ending perceived suffering. Furthermore, when a patient's death is hastened, are we not risking denying the individual the opportunity who seeks to unite his sufferings to Christ's own suffering and draw nearer to him as life slips away? In addition to imposing another's view of suffering on a patient, curtailing suffering by hastening death could deny the individual the final opportunity to be at peace with God. Now, we talked about doublespeak. I'd say 99% of people think that suffering's bad. You know, I'm a head and neck cancer surgeon. That's what I do primarily. And some of my patients in life suffer terribly. And I'll give them morphine and morphine and morphine to try to curtail that suffering. But here, you have suffering is good. So we repeat it vigorously enough, frequent enough, that suffering becomes good. These same people put out a legislative agenda, and they put out a scorecard to the legislature. And on that card, they tell the legislators how to vote on every bill. The vast majority of these bills have nothing to do with political ideology, but they want that control factor. And if you vary one vote from that, then all of a sudden you're a liberal. You're a rhino, Republican in name only. And they, like I say, even at the end of life, want to control what happens, because they want the patient or their family to have the last say in what is going to happen toward the end of life, and not the physician. And you know, the Hippocratic Oath states that we have to always do what we feel is best for the patient. And I've done that repeatedly at the end of life. But to them, that's not good enough, because as you remember, we set up ethics committees years ago to help us on these complicated end-of-life issues. You know what they call these ethics committees? Death panels, absolutely. And I can't tell you how many complex cases those ethics committees has helped me navigate with head and neck cancer patients. But that's the type of philosophy we are dealing with. They've put out, like our 2020, they just put this out. This is from the Texas Public Policy Foundation. This is a manual detailing to the nth degree how legislators should vote, put out by the exact same group of 3 or 4 people that control Empower Texas and some of these other conservative groups. And let me read you a little bit about the medical part, because these are tabbed, and every tab in here is clear except for one, and that's the tab for their healthcare concerns. And so they're going to be targeting this. They've developed what they call a competition model for healthcare, which means basically it's patient beware, caveat emptor. You have a chiropractor that can practice, do whatever he wants to, nurses, psychologists, whatever. It's competition out there. And this is what they say as far as the scope of practice for nurses. Texas law should mirror the most liberal, it's interesting to use that word, liberal scope of practice laws in the country, similar to those in New Mexico, such that APRNs are given prescriptive and diagnostic authority, the ability to operate independent on-site clinics, and to serve as primary care providers. So I know you're asking, well, you know, you've introduced us to all this. What are we going to do? As Pat Evans says, do we feel like we're lost? Well, I tell you, the politics is like, Joel, how many people here have seen The Wizard of Oz? Okay. Another group of old people, I tell you. Okay. You know, in The Wizard of Oz, it's about perception, actually, the entire movie. It's one of my favorite movies because of that. And you know, the main character is Dorothy and her 3 friends that go through, and they each have something that they want or that they want to accomplish. And it's only at the very end of the story that Dorothy finds out that because of her perception of herself, that she's always had the ability to go back to Kansas, ever from the very first start of the story. And you know the story about the Tin Man and the Scarecrow and the Lion and what they wanted, how the Scarecrow wanted to have a brain to be a profound thinker and a philosopher. And at the end, the Wizard of Oz knows that he's always had that capability. But he says to him, you know, you have everything you need to do that except one thing which others have that are profound thinkers, which you don't have. And it's a diploma. And he gives him the diploma, and he knows the diploma isn't going to matter, but because it changes the perception of the Scarecrow that he really does have the ability to be a profound thinker. And I think that's really what we're dealing with. You all say, well, how are we going to respond to these attacks? Well, we have a perfect vehicle to respond to those attacks. We've always had it. It's called TEXPAC. And you say, well, we're going to go out and we're going to put up PR spots and radio and TV spots. And that's great. We have the power and the ability to do that. We only lack one thing which the other side has, and that's money. You're going to say, well, we're going to go to these different people that are promoting this philosophy. We're going to tell them we're going to run candidates against you over and over again until we finally beat you. And we do. We have the power and the ability to do that. But they have one thing which we don't have, and that's money. You say in Dr. Dewell's race, where Dr. Dewell, because of his support of this end-of-life bill, he carried the Catholic bill in the Senate, and they told him if he did that, they would run a candidate against him, which they did. And at the very end, they didn't call him Dr. Dewell anymore. That name never appeared at the end, toward the end of the election. They called him Dr. Death because he helped set up death squads in the hospital, which they said that allowed his colleagues to put patients they didn't like in the hospital and then kill them. And you think, that's crazy talk. No one's going to believe that. You say it frequent enough and with enough vigor, people begin to believe it. And enough people begin to believe it to change an election. And you said, well, why didn't we get involved at the very end so we could counter this? And we could have. TEXPAC put a lot of money in that race. But at the very end, they had something that we didn't have, and that's money. So we control our own destiny. We can respond to these things, but it's up to you to respond, to talk to your fellow physicians about their perception of TEXPAC. 11% of us belong to TEXPAC. We have one of the smallest PACs up there. The Cattle Raisers Association that belong to us has more money in it than TEXPAC. If 50% of our physicians gave $100, just think how many millions that would generate. It's perception. And you know, the legislature is going to go back in the session in January. The land of Oz is going to be reconstituted. And I'm curious, in fact, I'm very curious of what role you all will play.